So TGA, exam entrance question number 1. What is TGA? TGA is nothing but transposition of great arteries. TGA is nothing but transposition of the great arteries. What great arteries are we talking about? So we all know this is the four-chambered structure of the heart. This side we have the pulmonary artery, and this side we have the aorta. The topic of choice we have is transposition. Transposition of the great arteries. So right side becomes the aorta and left side becomes the pulmonary artery. Left side becomes the pulmonary artery. If right side becomes the aorta and left side becomes the pulmonary artery, this is the right atrium, right ventricle. This is the left atrium and left ventricle. So how the patient will live if the right side becomes the aorta and the left side becomes the pulmonary artery? So how the story will start? We all know in our body, the deoxygenated blood enters the right atrium. From right atrium, it enters the right ventricle. From the right ventricle, normally the deoxygenated blood goes to the pulmonary artery. And because the pulmonary artery are connected to the lungs, and that is how the purification and oxygenation process takes place, yes or no? But now in this condition, the deoxygenated blood from the right atrium and right ventricle, it is going to the aorta, not to the pulmonary artery, to the aorta. Now we all know very importantly, aorta supplies the whole body the blood, thoracic aorta, abdominal aorta, the aorta, the blood goes to all over the body, and back again the deoxygenated blood is entering the right atrium. So can we appreciate this point that deoxygenated blood enter the right atrium, right ventricle and aorta, and then to the whole body and back again to the right atrium, right ventricle and to the aorta. Whereas on the left side, very importantly, we all know we have the lungs where the purified, happy, oxygenated blood enters the left atrium. The purified, oxygenated blood enters the left atrium. This oxygenated blood, which enters the left atrium, enters the left ventricle. From the left ventricle, the blood should be going to the aorta. That is the main thing. No, the purified blood goes to the aorta and supplies the whole body. But in this case, very, very important, it is going to the pulmonary artery. And pulmonary artery, we all know that again from the backside, it is connected to the lungs. From the backside, it is connected to the lungs. Please remember that. So can we appreciate this point that right side, the deoxygenated blood entering and deoxygenated blood leaving, and on the left side the oxygenated blood entering and oxygenated blood only leaving. Okay, so exam entrance question number 1, what do you call this circulation? This is known as parallel circulation. This is known as parallel circulation, number 1. Number 2, very importantly, now this is a parallel circulation where the one side, very importantly, deoxygenated blood entering and deoxygenated blood leaving, and left side, the oxygenated blood entering and oxygenated blood leaving. Now in this case, very, very important, if I keep the, have you heard of patent ductus arteriosus, PDA, yes or no? If I keep the patent ductus arteriosus open, in this case, if I keep the patent ductus arteriosus open, will it be of any usefulness, yes or no? So we all know that the left side of the heart, has a higher pressure than the right side of the heart, and if I keep the PDA open in this case, then the blood normally which is coming to the left atrium, left ventricle and then to the pulmonary artery, through the PDA, the blood from the left side is going to the right side. So bottom line, all the purified blood which was there in the left side, with the help of PDA, it is shunting on the other side. Now this is very, very important, must appreciate for exam purpose. That is why TGA becomes something known as duct dependent congenital heart disease. TGA becomes a duct-dependent congenital heart disease. If I ask a very simple question, name some duct-dependent congenital heart disease. One of the example is TGA. What is the meaning of duct-dependent? Means I'm saying, tell me some congenital heart disease where you are dependent on the duct. Which duct are we talking about? We're talking about patent ductus arteriosus. In simple words, I'm asking, tell me some congenital heart disease where I'm dependent on the PDA for the survival of the baby. And we all know that right now keeping the PDA open is beneficial so that the blood from the left side can go to the right side. The oxygenated blood basically from the left side can give some happiness on the right side. Okay, so that is why it becomes a duct dependent congenital heart disease. So if I talk about very importantly, what is the X-ray finding of this condition? The X-ray finding of this condition, exam question, where do you see egg on side appearance? So remember, where do you see egg on side appearance? Remember, the answer is TGA. Okay, and I'll show you also very importantly egg on side and this and that. Okay, so that is one thing in general you should know, egg on side appearance. And also TGA is the most common cyanotic congenital heart disease on day of life 1. TGA is the most common cyanotic congenital heart disease on day of life 1. 1 day old baby cyanotic. Can I say the baby will be cyanotic? Obviously, because the deoxygenated blood enter the right atrium, right ventricle, and then to the aorta. Oh my God, going to the whole aorta. So very importantly, please remember that what we called so yes, TGA, very importantly, the patient will be cyanotic. The most common cyanotic congenital heart disease, remember, that is nothing but, very importantly, is nothing but TGA. One more thing, in this condition I will do something known as medical management. What is the medical management of TGA? The medical management of TGA will be L-prostadil. L-prostadil. What is L-prostadil? It is a prostaglandin PGE1 analog. L-prostadil, it is a prostaglandin PGE1 analog. So we all know that L-prostadil will keep the patent ductus arteriosus open. I want this channel, right, to be open because this side is the aorta and this side is the pulmonary artery. So I want this patent ductus arteriosus channel to be open, and to open that, the drug of choice is L-prostadil. It is a prostaglandin PGE1 analog. So if I ask you what is the X-ray finding of TGA, the answer is egg on site appearance. Which is the most common cyanotic congenital heart on day of life 1? The answer is TGA. And next important point, if I ask you a question, what is the emergency management? What is the emergency management? Remember a very important point known as balloon atrial septostomy. Balloon atrial septostomy. So balloon atrial septostomy is the emergency management in a case of TGA. As a one-liner, 3 question you should know: medical management, what you called emergency management, and the definitive management. Medical management is L-prostadil. Now, TGA is, do you think it's a cyanotic or acyanotic congenital heart disease? So obviously, this is the cyanotic congenital heart disease in a day of life 1 baby. One day old baby cyanotic, you will think of very importantly TGA. Next, this TGA, it is also known as dextro-TGA. The one TGA where I told you that the right side is the aorta and left side is the pulmonary artery. So this is naturally known as dextro-TGA. There is something known as Levo-TGA also. This is right now the one I told you, that the right side is the aorta and the left side is the pulmonary artery. This is known as dextro-TGA. Number 1. Number 2, very importantly, what is Levo-TGA? What do you mean by Levo-TGA? Now in Levo-TGA, what happens? By mistake, naturally only the right atrium, it is connected to the left ventricle, and the left atrium, it is connected to the right ventricle. Now I'll repeat again, the circle. So anatomy in this condition, the anatomy is twisted. In this condition, the anatomy is twisted. In this condition, what happens in TGA, transposition of great artery, there is something known as Levo-TGA. This is Levo-TGA. Levo-TGA means in this condition, this is not about aorta and pulmonary artery twisted. It is not that. It is the right atrium is connected to the left ventricle by mistake, and the left ventricle is connected to the right ventricle by mistake. So that actually it is all. Can you appreciate this point that it's okay if it is there, because the right atrium, the deoxygenated blood enters the right atrium. Now you said right atrium is connected to the left ventricle. So this deoxygenated blood, very importantly, remember, exactly. So this one thing will say it over here. Yeah, this one. So this deoxygenated blood from the right atrium goes to the left ventricle, and left ventricle, we all know that very importantly, left ventricle, we have the aorta, and here we have the pulmonary artery. So listen to me very carefully. In normal TGA, right side is aorta and left side is pulmonary artery. But that is not happening here. In the Levo-TGA, only the problem is, remember, that the right ventricle has by mistake connected to the left ventricle, and left ventricle normally, naturally is connected to the aorta. So the deoxygenated blood from right atrium goes to left ventricle. Left ventricle, very importantly, yes. So left ventricle, so that is one thing you should know. So why it is known as congenitally corrected TGA. So we all know that very importantly, if I tell you this point like that, okay, imagine if the deoxygenated blood enters the right atrium is connected to the left ventricle. Now left ventricle, remember, it is connected to the, very importantly, to the pulmonary artery, and pulmonary artery are connected to the lungs, yes or no? Purification process happens in the lungs, and from the lungs, the happy purified blood, the happy purified blood enters the left atrium. And this happy purified blood, when enters the left atrium, then I said left atrium by mistake is connected to the right ventricle. So that's it. So this purified blood from the left atrium goes to the right ventricle, and right ventricle is connected to the aorta. The right ventricle is connected to the aorta. Now, this is very importantly known as, remember, that is Levo-TGA. Okay, Levo-TGA. Listen to me very careful. This is known as, the right now in front of you, the exact picture, that is the Levo-TGA. So Levo-TGA, it is also known as congenitally corrected TGA. Yes or no? Even though there is a transposition, right side is aorta and left side is pulmonary artery, even though there's a transposition, but sadly it is a congenital corrected TGA. Okay, means the circulation end up being correct. The circulation end up being correct, but the anatomy was twisted. Are you understanding? So that is the one thing you should know in a case of TGA. Okay, right atrium to left ventricle to the pulmonary artery. So we'll write here, we'll rub this point over here. So this is the simple thing you should know, which I'm telling you. I'll repeat again. In Levo-TGA, the right atrium is connected to the left ventricle. So the deoxygenated blood from the right atrium goes to the left ventricle. From the left ventricle, the deoxy blood goes to the pulmonary artery, then go to the lungs. Purified blood from the lungs enter the left atrium, and then to the right ventricle, and then to the aorta. That's it. That is one thing. Next question. TGA, it is the most specific congenital heart disease in which condition? So have you heard of infant of diabetic mother? Yes or no? So the most common congenital heart disease in infant of diabetic mother is what? The most common congenital heart disease in infant of diabetic mother is a VSD, and most specific, that is TGA. The most specific, that is TGA. So that you should know. The MCQ, the most common congenital heart disease in infant of diabetic mother is a VSD. Most specific, it is TGA. Number one. Number two, what are the classification of TGA? Now, transposition of great arteries. So just now we spoke about it. Number one, we know this side is the aorta and this side is the pulmonary artery. So there could be one TGA with intact ventricular septum where there is a this VSD is totally intact. In that case, so obviously I have to keep the PDA open. Yes or no? That is one TGA. There is one TGA with VSD. There is a transposition of great arteries. This is the aorta. This is the pulmonary artery, but there is still a defect VSD that is open. So TGA with intact septum, TGA with VSD, that you should know. Okay. So that is one thing. Which is the best mixing site in case of TGA with intact ventricular septum? Very nice question. What do you think, guys? What is the best mixing site in case of TGA with intact ventricular septum? This septum is totally intact. अब mixing का site कहाँ पे होगा? Which is the best mixing site? If the VSD was there, then mixing was happening here also, mixing is happening here also. So remember the answer to this question very importantly is foramen ovale. Foramen ovale. Definitely by giving the L-prostadil, I will keep the PDA open. Are you understanding? The question is, which is the best mixing site in a case of TGA with intact ventricular septum? If this septum is intact, definitely I can, give L-prostadil and give PDA. Mixing will happen. But if I don't give L-prostadil, here you have foramen ovale. Yes or no? Here you have foramen ovale. So at the foramen ovale level, at this time, the best mixing site it is there for the intact VSD. Remember that. Okay. Number one. Number two, there is TGA is associated with uncontrolled phenylketonuria in the mother. Remember that as a one-liner. If the mother has a phenylketonuria, her baby can land up into TGA. So as a one-liner, TGA is associated with uncontrolled phenylketonuria in the mother. That is one thing. Now, very importantly, I told you the medical management of TGA was L-prostadil. Yes or no? Which is PGE1 analog, where you keeping the PDA open is very important for the survival of the baby. Whereas I asked you the emergency management. The emergency management, very importantly, that is nothing but that is balloon atrial septostomy. Emergency management is balloon atrial septostomy, which is also known as Rushkind procedure. This is also known as Rushkind procedure. So balloon atrial septostomy, which is also known as a Rushkind procedure, which is done in TGA. If I say TGA, that is nothing but I'm talking about dextro-TGA. That Levo-TGA is very rare phenomenon which happen. In simple words, if you're telling that the right side is the aorta and left side is the pulmonary artery, transposition has happened. So this is also known as dextro-TGA. This is known as dextro-TGA. Remember that, okay? That you should know. So that is one thing. And also if the right atrium is connected over here and left atrium is connected over here, now that will be known as Levo-TGA. This is known as Levo-TGA. Okay, that you should know. So if I ask you which is the most common congenital heart disease in full cardiology, the most common congenital heart disease in full cardiology, if we talk about a cyanotic congenital heart disease, that is VSD. And the most common cyanotic congenital heart disease in cardiology, if we talk about a 1 day old baby, day of life 1, the answer is TGA. And in older children and in older age group, the answer is TOF. What is TOF? Tetralogy of Fallot. What is TGA? Transposition of great arteries, that you should know. Okay, and what is this VSD? Ventricular septal defect. Okay, that is one thing. We have done everything perfect. Yeah, last but not the least, egg on side appearance. We all know that egg on side or egg on string. Some book says egg on side. So that is one anda ande pe dhaga. So egg on side appearance that you see in a case of TGA. So these all things we have done. This is a very nice question. Clinical feature. Number one, can the patient will have cyanosis? Yes or no? So just now we spoke about it that the deoxygenated blood entering the right atrium, right ventricle, and going to the aorta. So yes, that definitely the patient will be cyanotic. But one good nice point which it has given is that the time of presentation depends on whether ventricular septum is intact or VSD is present. Are you understanding? If the patient has a TGA, that is, this is aorta and this is pulmonary artery. If this is totally intact, then the cyanosis and failure feature will happen. And if this defect is there, then automatically the blood very nicely can go over here. Yes or no? So that is the whole story, na? So TGA with the intact VSD will present early. So we all know that. Okay. Yeah. Patient with TGA with intact septum are cyanotic at birth and they develop failure in the first week of life. So it means very, very bad. Within 1 week, the TGA with intact septum will present. If there is a TGA with the VSD, okay, so mota, I will remember part cardiology thing that TGA with the VSD, part cardiology says by 3 to 4 months, the baby will come to you with failure. So TGA with intact VSD within 1 week with failure, and TGA with ventricular septal defect, it will take around 3 to 4 months to come to the doctor. That you should know. Done. That part you should know. Simple words. And yeah, so in a case of, I told you, yes, cyanosis will happen. I told you, yes, congestive heart failure. Congestive heart failure also will happen. And one extra point they ask in exam, that is single second heart sound. So you'll have a single second heart sound. When there is a switch, the aorta comes on the right side and pulmonary on the left side. So this switch basically produces a single second heart sound, that is single S2. Single S2 is heard over here. If I ask you, where else do you see single S2? So that's an exam question. Can I say tetralogy of Fallot? We all know in tetralogy of Fallot, there is a pulmonary stenosis. And we know that the second heart sound, it is because of the closure of the pulmonary valves and aortic valves known as P2 and A2. Just because in tetralogy of Fallot, I have complete pulmonary stenosis, only aorta sound will come, and that is why you will have a single second heart sound. So TTT, just remember TGA, truncus arteriosus, and TOF. In TGA and truncus arteriosus and tetralogy of Fallot, you will have a single second heart sound. Please remember that. Yes, so this is all thing we have done. Everything we have, kind of spoken about it, and everything is done and dusted. Okay, now this is a very nice point I would like to mention. This slide. Okay, this is the last slide now. So, this is a very interesting slide. Now I told you TGA, number one, parallel circulation, cyanotic congenital heart, X-ray showing agon side appearance. Now have over here. Now this is the artery and this is the aorta and this is the pulmonary artery. That is a problem. No? Right side is the aorta and left side is the pulmonary artery. Now, very importantly, we'll do the operations. Now, there are many operations. There is Senning operation, Restili operation, and arterial switch, which is known as Jettini repair. Jettini repair. So it's very easy. If I'm Senning operation is done at the atria level, where I'll switch the atria only. Okay, right atria become on the other side and left atria on this side, or I'll switch the ventricle. Like Restili operation is almost like a Levo-TGA. Remember that we kind of I'll tell you. So Senning operation is done at the atria level. Restili operation, you are changing the ventricles, whereas arterial switch is at the great artery levels, which is in simple words that I'll do one operation where I'll again put it back. This side becomes the pulmonary artery and this side becomes the aorta, like an arterial switch. If you're switching the right ventricle and left ventricle like that, that is known as Restili repair. If you're switching the right atrium and left atrium like this, switching like that, that is known as Senning operation. Senning operation. Number one. Okay, this is very important for exam purpose. Okay, so I'll repeat again. In Senning operation, you're switching the atria. Instead of switching the both pulmonary artery and aorta, you are switching the atria. Remember that. And one more thing you should know, there is something known as Senning operation and something known as mustard operation. Senning operation and mustard operation. In simple words, I can say in Senning, I take the patient own tissue, whereas in mustard, I take a synthetic material. I take a the Teflon or Dacron. I take some synthetic material. Here I'm using the patient own tissue. Senning and mustard are nothing but same only. That is done at the atria level. We are switching the atria, where you are switching the atria. Now, what is Restili? I told you Restili operation is done at the ventricle level. Restili operation is done at the ventricle level. What does that mean? That means very simple, that the blood is coming, the deoxygenated blood is coming to the right atrium. From the right atrium, it is going to the right ventricle. We know now that in this TGA, right side is the aorta and left side is the pulmonary artery. Yes or no? So nothing. Now I'll just connect my right ventricle to the pulmonary artery. I'm connecting my right ventricle to the pulmonary artery. So that is so naturally the deoxygenated blood enter the right atrium, right ventricle, and right ventricle I'm connecting to the pulmonary artery. In a case of Senning operation, I was going to connect my right atrium to the left ventricle. When I said na, atria level. So that Senning operation at atria level, I was connecting my right atrium to the left ventricle. So that's it. The deoxy blood enters to the right atrium, then goes to the left ventricle, and from the left ventricle, they are connected to the pulmonary artery. The full purification, oxygenation happens from pulmonary artery, blood goes to the lungs. From the lungs, the pulmonary veins basically carry the happy blood to the left atrium, and left atrium is connected to the right ventricle. This was arterial, like atrial switch. So that I meant was this only, Senning operation, atrial switch. Are you understanding? That connecting the right atrium to the left ventricle. In ventricular level, I'm connecting the right ventricle to the aorta, and right ventricle, we're connecting the right ventricle. Basically, you're connecting the right ventricle. That much you should know. You're connecting the right ventricle. That's it. Okay. And right ventricle over here to the pulmonary artery, and left ventricle to the aorta. So that's why we call it as at the ventricular level. I hope you understood now. And nothing but Senning operation. Senning operation is almost like a Levo-TGA. Can I say that? I said in Senning operation, which is done at the atria level, where I connect my right atrium to the left ventricle and left atrium to the right ventricle. So don't you think this almost looks like a Levo-TGA? This looks like a congenital corrected TGA, yes or no? So Levo-TGA was a separate entity, but the story was same. That automatically anatomy is little twisted, but the connections by mistake came right. So the right atrium connects to the left ventricle, and what we called the left ventricle, we all know the deoxy blood, no, it is connected to the pulmonary artery, and pulmonary artery purification is there. Purified blood from left atrium went to the right ventricle, and from the right ventricle, it went to the aorta. So that is one thing, very happy thing you should know regarding this case. Did you understand? So that is important. Okay. And yeah, that's it. We have something known as Nikaido procedure. That also one conduit or one thing is there. What is Nikaido procedure? It is done in a patient of TGA. So TGA, this is the aorta, this is the pulmonary artery, TGA with the VSD. There is a VSD here with the pulmonary stenosis. So TGA with VSD with pulmonary stenosis, we do a procedure, operation we do basically, that is known as Nikaido procedure. That you should know, remember, just like a one-liner, TGA with VSD with pulmonary stenosis. If pulmonary stenosis were not, it was good, but now it is there, so we do a procedure known as Nikaido procedure. That's it. That finishes this class for today. Thank you so much, everyone. And very important, this is important, okay, like this one, okay, sending operation done at atria level, where the right atria is connected to the left ventricle and left atria to the right ventricle, whereas restili is done at the ventricular level. Ventricular level means where the right ventricle is connected to pulmonary artery and left ventricle to the aorta. Then third is the arterial switch. Instead of connecting here and there, you just switch only. You put the aorta back to the left side and you put the pulmonary artery back to the normal right side, and that's it. So that you should know. That's it. I think that's enough for today. So thank you so much, everyone. Life is beautiful. Please take care. Watch this video again and again. These are very nice questions. Nikaidu procedure, sending, mustard, restili. Okay. So remember SRA. Okay. Shahrukh Khan, SRA. So sending operation, then restili operation, then arterial switch. So S, then R, then A. Sending, restili, and nothing but arterial switch. Before leaving, this is the quote. So very beautiful this picture is. I love this picture. So this patient is dying, you know. So the first person is doctor. He can save him. We all can save a child. And then behind is the nurse. Then we have the priest, then God, then Jesus and everything. And then we have this fellow who is waiting, who is in the waiting list. If all these people go, the doctor goes, nurse goes, everyone goes, then he is just waiting behind, you know, Yamraj to take the patient. So that is life, you know. Live life. Life is really good. So that's it. Please take care. Thank you so much, everyone. Watch this video again, repeatedly. I have repeated the terms and words. So try to clarify them very clearly in your mind, and that is important. So please take care. Thank you so much, and bye bye.